Thank you very much. And thanks to the 7 folks who've come along to this session, Day or Night, Sleep Right. Safeguarding week, and we picked a beautiful week outside, haven't we? It's a gorgeous weather where I am. I'm hoping it is where you are too. So the aim of today's session on Day or Night Sleep Right is to raise your awareness of a campaign across North Yorkshire and City of York aimed at reducing the incidence of sudden unexpected deaths in infancy, and also to support yourselves if you are practitioners working directly with families, to have an increased knowledge and understanding of the factors that increase the risks of SUDI and how you can support reinforcing safe sleep messages to families. I'll just pop that one slide up to show, because that's usually my beginning slide. So this is just the logo, the strapline for our campaign across North Yorkshire and City of York. So probably quite useful to start off with the definition of what a sudden unexpected death in infancy, or a SUDI, is. This is the official definition that we still work to. It was developed back in 2000 by Professor Fleming, and it talks about an unexpected death of an infant which wasn't anticipated 24 hours before the death. Or it talks about a similarly unexpected collapse leading to the death of a child. And importantly, it's talking about infants under the age of 1 year. You may have heard of the term sudden infant death syndrome. That is another term that is used to describe this issue. And you may also have heard of the term cot death. We certainly try to steer away from the term cot death now, because that implies that these tragic deaths occur only when infants are sleeping in a cot. And as you'll see as we go through the presentation, that certainly isn't the case. So we do try and avoid using the term cot death these days. So that is the definition of SUDI. We normally would be playing a slot here, a minute and SO slot, coming from the Lullaby Trust, which is a parent's experience of SUDI. Unfortunately, we've got some technical difficulties this morning, but what we can do is send out the link for you from the Lullaby Trust to this video recording of a mum. It pretty much goes without saying, doesn't it, that a SUDI is one of the most devastating tragedies that could ever happen to a family. That's obvious. But it's also important to stress the wider impact that a SUDI can have in terms of the impact in the community, wider family members, friends, but also the impact on professionals working with the family can't be underestimated too. We, as I'll talk shortly, I've sadly had a number of SUDIs in our locality across North Yorkshire and York, and one of the things that always strikes me is the information that we get about practitioners and how this has impacted upon them. And certainly I am a health visitor by background, and one of the things I remember very well are the families where I needed to do a bereavement visit for families who'd experienced a SUDI, and those are very vivid memories of walking up the path to the house and knocking on the door and seeing the parents for the first time. It's an absolute tragedy to happen in any family. We thought it would be quite useful to show you this slide, which talks about the incidence of SUDI, and it provides us with some really useful insight in terms of what can work and how public health campaigns have previously been successful. So as you can see on this graph, it takes us back to 1985 up until 2018, and it's referring to the incidence. And as you can see, there was a very significant drop in the incidence of SUDI during that period between 1985 up until the mid-1990s. And those of you who are attending today who are a little bit longer in the tooth like myself may remember the public health campaigns back then, which have been reinforced since. The main campaign was actually driven by a lady called Anne Diamond, who was a TV presenter who sadly experienced the sudden unexpected death of her son Sebastian. That public health campaign was largely focused on three key areas, which was sleeping babies on their back, so the strapline was back to sleep, avoiding passive smoking around an infant, so avoiding a smoky environment, and also trying to ensure that the infants don't get too hot. Those were the three key factors at the time we thought were the largest contributors towards a SUDI. So that was a pretty successful campaign, but as you can see from the graph, from the mid-1990s, things have sort of really plateaued off. And what we are still seeing, sadly, is 300 plus infants still dying every year across England and Wales as a result of sudden unexpected deaths in infancy. So that's almost one infant every day that we are losing to SUDI. During this period of time, the research has been ongoing, and we've got more and more information about the things that it can increase the risk, which we're going to talk about in a little bit more detail later on in this 1 hour session. Okay, so that's the national picture, and as I say, the research has been ongoing. This is also a really useful national report, which was published by the National Safeguarding Children Practice Review Panel back in 2020. It was their second thematic report, and they focused down on cases or incidents that were referred into the panel, of which that year there was 568. Of 40 of those cases were of sudden unexpected deaths in infancy in families where there were already significant concerns from a safeguarding perspective. So these were in families where the unborn infant and other siblings were subject to child protection plans. As you can see there, the Venn diagram shows us that there were 325 SUDIs that year. So 40 of those were in these families. And the national panel came to some very important conclusions for us during that thematic review. What they concluded was that although the safe sleep messages are rigorously delivered by health professionals largely, and those messages are delivered universally, both antenatally and postnatally, although that those are delivered, for some of our families with increased vulnerability, for whatever reason, those families are not able to act upon, or are unwilling or unable to act upon those safe sleep messages for a multitude of reasons. Also, really importantly, what they concluded was that these tragic deaths occur far more frequently in families that are particularly vulnerable, with many of the risk factors associated with SUDI overlapping with those for child abuse and neglect. So that was quite a significant report that was published back in 2020. What the panel advocated was that we need to start looking at reducing the risks of SUDI through a safeguarding continuum. So as you can see there, this is a useful diagram that describes the continuum of practitioners' involvement with families. So at the left-hand side, you can see that that's the universal offer that we provide to families. But as we go up that continuum, as there are increased vulnerabilities and eventually reaching the point where there may be significant safeguarding concerns, the risks of SUDI start to increase, and we need to start thinking about modifying, tailoring our messages and our support to those families with those increased vulnerabilities. So this is the National Safeguarding Practice Review Panel's recommendation that we start to look at SUDI through a safeguarding continuum. So that's the national picture, but looking at things locally across North Yorkshire and York, we pretty much mirror the findings from the National Panel's report. So back in 2020, purely coincidentally, the North Yorkshire and York Child Death Overview Panel identified that over the preceding 2 to 3 years, there'd been an increase in the numbers of SUDIs where unsafe sleep practice was found to be a significant modifiable factor. The panel then went back and looked over a five-year period, and they concluded that almost without exception, these deaths were taking place in families where there was those increased vulnerabilities such as alcohol misuse, there were issues over co-sleeping, tobacco use at the time of the infant's last sleep. So that was the findings from the CDOP. Additionally, and very sadly, both the North Yorkshire and City of York safeguarding partnerships had undertaken 3 safeguarding practice reviews or reviews of cases where there'd been a SUDI and there had been concerns from a safeguarding perspective. And again, in all 3 of those cases, there were very significant concerns from a safeguarding perspective, including issues such as domestic abuse, substance misuse, and again, some real key concerns around sleeping positions and co-sleeping with infants. Okay, so our response. So what we had was these 3 things coming together: the National Panel report, the CDOP audit, and our reviews locally. So the first thing that we needed to do is do a bit of a stop the clock. What are we doing now across North Yorkshire and York to support families to reduce the risks? And then we can make decisions about what else we may want to do. So we undertook an audit across North Yorkshire to see what was happening, and that concluded that, usefully, that all health providers across North Yorkshire and York were delivering appropriately safe sleep messages both during the antenatal and postnatal periods with all families. So that universal message was being delivered. And those messages were research-based. There were appropriate information that was being provided to families. So that was really useful for us to be able to see. But that still left us in a position where we had the families with the most vulnerabilities, and what do we need to do to try to support those families? So what we did as a task and finish group, we presented papers to both City of York and North Yorkshire safeguarding executives describing the findings from those 3 aspects, from the panel's report, from the CDOP, and from our reviews. And we requested the permission from the executives to develop a campaign across North Yorkshire and York, which would look at enhancing partner information sharing and information provision to families around reducing the risks of SUDI. Because although we had that confidence that that information was being provided by health professionals, what we didn't have is that assurance that our colleagues working in other agencies felt necessarily that they had the information skills to be able to reinforce those messages with families with increased vulnerability. So the partnership agreed that we would go ahead with this campaign. A couple of important things to remember, and which we were always very mindful of, is that, as I've described, it's vital that all professionals are aware of safe sleep for infants and reinforce the evidence-based messages, but also that we are realistic. And this quote comes from Professor Fleming, and he describes how most parents do fall asleep while feeding their infants. That may be unintentional, but what we do need to try to do is to support those parents to minimise the risks should that occur. So to reduce the factors that would increase the risks of SUDI. So it was just an important reminder for us. We were not looking to prevent families from co-sleeping with their infants, what we were looking to do is to try and support families to adopt the safest sleep methods they possibly could. Okay, so just a question for everybody, and I can't see the chat, so I'll ask James if he can shout out if he can see the chat there for us, if we have any responses. Just wanted to ask you to think really, what do you currently discuss with families about safe sleep? What do you base this information on? And do you give the same advice to all families? So if anybody wants to put their mic on and speak out, that's absolutely grand. If you want to pop that information into the chat, then that's absolutely fine too. But just wanted you to reflect on your knowledge around safe sleep.
I think people have to just pop it in the chat at the minute, Karen, because I think everyone's muted and okay. At this stage. So yeah, if you've got any comments or answers, how you deal with any of those, pop them in the chat and I'll read those out.
Okay. I think what we'll do then, please continue to pop anything into the chat on that particular slide. But if we just move on to the next slide, because this is where we're going to send you off into breakout groups. And you might want to jot these down on a piece of paper that you might have in front of you. What we're going to do is send you off into a few breakout groups and want you to consider these 3 questions. The first one is, what do you know about parental risk factors for SUDI? So what are the things around the parents that might increase the risk? We want you to consider which infants are most at risk of SUDI. So there are particular groups of infants who are at increased risk. And importantly, what aspects of an infant's environment can increase the risk of SUDI? So if you can, when you get sent off into your breakout groups, if you can spend perhaps 10 minutes thinking about those 3 questions and then nominate a spokesperson to come back and provide the answers, that would be good. So if you want to send everybody off now, James, that would be great. Okay, so the first question we asked you to consider, what do you know about the parental risk factors for SUDI? So we just want to go on and press the first slide, but avoid all the answers coming up, please, James. So does anybody want to kick us off from your groups? Just go back over there, James, please. With parental risk factors. So does anybody want to start us off with that? What do we know about parental behaviours that can increase the risk of SUDI?
Smoking.
Yeah, brill, excellent, absolutely. Smoking, and importantly, smoking not just when the baby is born, but also during the antenatal period as well. So we know that when a woman smokes during her pregnancy, the research is really clear that that can increase the risks of SUDI once the baby is born. So antenatal and postnatally, but also smoking around the baby by anyone, you know, that could be extended family members. So really important for us to think about that. Okay, so smoking, and I think, Ellis, you popped into the chat there, substance misuse. Absolutely. We do know that one of the key risk factors for SUDI is illegal substance misuse and misuse of prescription medication as well. So we do know that that can increase the risk, because often leads to unsafe sleep choices by families. So, and again, it's also important to recognise that substance misuse by a mum during pregnancy, again, can increase the risk of SUDI post-delivery. Okay, anything else from anybody?
Mental health.
Yeah, excellent. Yeah, absolutely. So you might think, well, why would a mental health problem for a parent increase the risk of SUDI? There's a number of different factors. What the research is pointing towards is that it can often be linked to a parent may be less attuned to what the baby needs, particularly if it's a significant mental health difficulty. And sometimes it's associated with a medication that somebody may be prescribed for a mental health condition, which may again make them less attuned to what the baby's needs or may make them more drowsy. So yeah, absolutely, mental health difficulties for the parents too. Okay, so Ellis has put co-sleep with parents, siblings or pets. Yeah, we'll come to that, Ellis, because when we look at the environment one, that is a really important one, and I'm really pleased you said pets, and I'll reflect on that shortly. But is there anything else there that people wanted to contribute in terms of parents? Okay, do you want to pop them up then, please, James? I think you've got most of those. That fourth bullet point sometimes makes me smile. Excessive tiredness. It sort of goes with the territory with a new baby, doesn't it? But it's when a parent is excessively tired and they then subsequently make unsafe sleep choices. What I've often seen in our local cases and in some national cases is we've had a parent who has been trying to help by taking the baby off downstairs to allow the other parent to have a sleep or the partner to have a sleep, and then they've chosen to sleep with the baby on the settee or on the sofa. We'll talk about that shortly, and sometimes that can lead to a tragedy. So excessive tiredness, it can be a key factor. Okay, moving on to the next slide, please, James. Again, just putting the first one up. So does anybody want to chip in with risk for individual children? So which children are most at risk of SUDI? Anybody want to help us out?
I was going to say premature, is it up to the age of 1?
Yes, absolutely. Yeah, that's absolutely right, Hannah. And Ellis, you've popped in there, premature babies or babies with low birth weight. Absolutely. So our babies with low birth weight and premature can be just those factors. They can also be associated, of course, with the other factors that we've described in terms of maternal substance misuse or smoking. So babies who are of low birth weight and babies who are premature, we do know there is an increased risk of SUDI. Anything else there about individual children?
Are males more likely?
Yes, absolutely. Yeah. I'm not sure who that came from, but thank you. Absolutely. And it's really interesting. It's marginal, but it is clear from the research. We don't know the reasons why, but we do know that male infants are marginally at increased risk of SUDI. It's a really interesting one to think about why that would be, but I don't think we've come up with a firm conclusion, but that is the case. So yes, thank you for the person who contributed to that. Any other groups of children? Okay, do you want to pop those up, Jill? Or Katie's typing in there. So you're busy typing away. Nope. Oh, right, excellent. Thanks, Katie. You're absolutely right. And that probably goes along with the one that I've said that infants who are unwell with an increased body temperature. So as we described earlier, one of the factors that we focused on in the 80s and 90s was trying to avoid infants getting too hot. And when an infant becomes unwell, of course, they often get a temperature. So we do know that infants who've got a temperature and unwell can be increased risk. What we've done there, and the slides can come out to you, is we've put a link to the Baby Check app, which is a really useful app for parents, on the Lullaby Trust, which helps parents make a decision as to whether or not they need to seek medical help for a child, because that's not always as easy as it seems. Alice, you popped in there, children who have had inadequate prenatal care. Yeah, absolutely. If there hasn't been good antenatal care, and often, once again, it's associated with many of the factors that we've already described, then again, we do know that can lead to increased risk. And sometimes families where there are existing safeguarding concerns, that can be a factor where they're not accessing healthcare in the way that we would want them to optimise their baby's health. So an important one. Okay, so moving on to the next slide, please, James. Right, environmental factors. Okay, if you just want to take that back from me, James. Yeah, great. What are the environmental factors? Now, Alice mentioned co-sleeping with parents, siblings, or pets. Really quite a critical one, because actually what we have seen in our locality and in some of the cases nationally, it hasn't necessarily been about co-sleeping with parents, it's about big co-sleeping with siblings. And we've had some really dreadful situations where it's felt that an older sibling has overlaid the baby and obviously caused a significant risk and resulted in a SUDI. And we've also had situations where pets have been in the bed with the family as well. So again, that you can't secure an infant safe sleep if you've got a dog in the bed with you, or a cat, or possibly another family pet. Any other factors there about the environment?
The number of users on the mattress.
Yeah, absolutely. We would, in terms of mattresses, again, there was a lot of controversy back in the 90s about mattresses and possibly chemicals being released from mattresses, etc. We would also always advocate that a mattress meets the usual safety standards that we would expect, but also that it's a clean mattress for the infant too. So that would be really important. Anything else around that about mattresses, etc., that sort of thing that you can think of?
Keep all, like, nothing else in the cart, like no toys and bumpers and things.
Absolutely, yeah, I think that might have been Lisa who said that. Yeah, absolutely. A clear sleep environment is a safer sleep environment. Always tempting to put multiple teddies and toys that the infant might have been gifted after they've been born, but we always advocate a really clear environment, and absolutely no duvets, avoiding use of pillows, and as you said, cot bumpers. The other thing which has been more popular of late is these devices that snuggle around the baby's head. They've got various names, but basically they sit around the baby's head and are supposed to make the baby more settled. I think a number of influencers have been trying to encourage people to use these devices. We would absolutely, and I think the Lullaby Trust supports this, is advocate non-use of any of those things. It's no different really effectively to having toys and bumpers and pillows within the sleep environment. So advising parents not to use those too. Anything else? Okay, do you want to pop them up then?
I was going to say, can it all come under like poor housing and overcrowding and sort of environments like that?
Yeah, absolutely. If you've got as we have seen, is if you've got a family of 5 living in a 2-bedroomed house, and particularly if it's a household that's not well kept, it may be but maybe there are general concerns about neglectful home conditions. There is a greater chance that you're not going to be able to provide a safe sleep environment for your child, or that you may choose unsafe sleep practice. So yeah, neglectful home conditions or overcrowding is a key factor. Okay, do you want to pop them up? Because there's a couple I just want to talk to, please, there, James. The ones I just want to mention are car seats. And again, some of you on the call may be very familiar with this, but we strongly advocate, as does the Lullaby Trust, that car seats are only used for transportation of infants, and young infants should only be being transported for short periods of time, short journeys. Similarly, we would not advocate the use of the baby chairs at a too young an age. The reason for that is that very often when they're very young, their head control obviously is not as good as what it will be when they're older, and it can lead to their head sort of lolling forward and actually cause problems with their breathing. So the use of car seats only for short journeys and not for long-term sleeping. Similarly, the baby seats, and that was sadly with the case in one of the cases across North Yorkshire, New York, a baby seat was being used in an extremely young, very small, premature infant. We've got there as well about the room temperature, really important to spot families to get the room temperature right, especially in these warmer days, but also over the winter period where a parent actually may overwrap a baby because the environment may be cool, especially if the heating bills continue to rise as the way they have been. There is a risk then of overheating the baby if you overdress the baby. So keeping the temperature cool and not over wrapping a baby. And probably the most critical thing is sleeping on sofas and other surfaces. And I mentioned this earlier, but this often, very often is the case that we're seeing in North Yorkshire and York. Parents are choosing to take their infants onto settees, onto sofas, might be just as a means to give the other parent a break, as I've said before, but very often then what happens is that parent falls asleep, the infant ends up in a really unsafe sleep position. So we would always discourage parents from sleeping on sofas and couches that are inappropriate. So the key message really about the environment is choosing a safe place for your baby to sleep, free from clutter, and preferably sleeping on their back at the bottom of that sleep space. Okay, so just moving on to the next slide. Thanks everybody for your contributions. The one thing that the national panel identified is very often there are situational risks on the night of the baby's last sleep that lead the parents to make unsafe sleep choices. Just want to move the next one, James, and pop them up. These are the sorts of things that we have seen in our locality and also nationally, is particularly that second point. If there's domestic abuse in the household, sometimes the parent will choose to take the infant into bed with them. That may be to try to protect the infant. We've had instances where a parent has taken not only the infant but the other children into bed with them because a domestic abuse incident is starting to arise. So it's also about if a parent is fleeing domestic abuse and they're going to an unfamiliar environment, and again that may make it much more difficult for them to make those safe choices. I know that we've had colleagues on from the IDAS refuges across North Yorkshire and City of York on the training previously, and they were going to take some specific steps, which was really helpful to hear, around ensuring safe sleep within their refuges, to make sure that parents were able to make those safe choices. And as we've said, alcohol and drug misuse sometimes we sometimes get, sadly, we get a bit of a glut of SUDIs around holiday periods because parents may be drinking more on those occasions and don't necessarily follow the safe sleep advice. And you can see there temporary accommodation and visiting relatives and friends. Again, we've had some situations where families have been visiting relatives and have not been able to make the safest choices for their children. So those situational risks and out of routine circumstances are critical to think about. Okay, next slide, please. That's really just been a light touch over the sorts of things we would like you to become more aware of if this isn't something that you talk about with families on a daily basis, but feel that you could be in a position to reinforce these messages. This guidance is on the partnership website, goes into a lot more detail on how we can reduce the risks of SUDI. So please feel free to access that. You'll see the link is on the slide there, that will support you to have those conversations with families, because they're not always the easiest of conversations, but it's so helpful if other professionals other than health professionals reinforce the messages. Next slide, please. So what can you do to support? Yeah, pop them all up, James. Yeah. So Identifying and responding to risks must be a dynamic and responsive process. So by that we mean, if we think about what we've just talked about in terms of situational risk for families, is if you're working with a family and their situation just changed, revisiting that conversation with them, reinforcing the messages is really helpful. It's also really helpful to demonstrate that professional curiosity and respectful uncertainty, because parents may say or give you information about where the baby is sleeping, but actually there is a safe sleep space for them, but that safe sleep space is never being used, and that's something that we've seen sadly in many of the cases across North Yorkshire and York. Using motivational interview techniques, many of us are familiar with this now. It's really important to understand why parents are making the choices that they're making in order for us to support them to make the safest choices. And what the research clearly says is that if you give a parent a list of do's and don'ts in terms of safe sleep, they're going to choose the ones that are easily achieved and may not follow the ones that are less easily achieved. So that's why motivation interview techniques are really quite critical, so we can understand why they're making the choices that they're making. Support families to consider safe sleep in changing family situations. And there's another slide there, James, please. I'll pop them up. And critically, and we would really ask you to consider this, as we've said, is the national panel and our local partnerships want us to start thinking about reducing the risks of SUDI through a safeguarding lens. So therefore, the risks of SUDI should be part of any assessment processes, safeguarding assessment processes that are being undertaken. It should also be part of any multi-agency plans for an infant under the age of 1 year, or where we've got an unborn baby, where we'll be able to do some planning and work with families. So really, really quite critical that we start seeing it as part and parcel of our safeguarding assessments and safeguarding plans for those families with increased vulnerability. And if the families aren't following that advice, despite your best efforts, think about seeking some safeguarding advice from the person within your own organisation. Do we need to think about this, escalating the concerns if we think there's some very significant risks to the infant? So thinking about SUDI through a safeguarding lens is really critical. Okay, next one, please, James. And just to reinforce the additional resources that are out there, I can't stress enough the importance of accessing the Lullaby Trust website if your role includes supporting families in this area of work. It has some really excellent resources, as too does BASIS as well, some good research-based, evidence-based resources. You know, most of our, well, all of our health providers across North Yorkshire and York follow the Lullaby Trust guidance, and that's because it's really good information. Okay, next one, please, James. And of course, that's reinforced by the information that we've got available on the partnership website. And as I've said, the multi-agency guidance is there for you to support you to have those conversations with family. It gives you some practical tips on how to open up those conversations, because they're not the easiest of conversations to have with families, and how you can keep on reinforcing and revisiting those messages with families in a supportive way. Okay, there's a load of references there. I'm sure you'll be all dashing off and reading all of that research. But they are there for you if you want to look into this particular area in more detail. Thanks for listening.